Let's dive right in. Question 1. A client with acute pancreatitis reports severe epigastric pain radiating to the back. Which intervention is the priority? A. Administer 4 opioids. B. Offer clear liquids. C. Give aluminum hydroxide. D. Encourage ambulation. Correct answer, A. Administer 4 opioids. Rationale: severe pain is common with pancreatitis due to autodigestion, 4 opioids are required. Strategy: manage life-threatening pain and complications first. Question 2. A client with COPD is receiving oxygen at 4 liters per minute via nasal cannula. The nurse should: A. Maintain flow at 4 liters per minute. B. Reduce oxygen to 1 to 2 liters per minute. C. Switch to a non-rebreather mask. D. Encourage deep breathing every hour. Correct answer, B. Reduce oxygen to 1 to 2 liters per minute. Rationale: high oxygen can suppress hypoxic drive in COPD. Strategy: when dealing with COPD, use low-flow oxygen unless ordered otherwise. Question 3. A client with heart failure suddenly becomes dyspneic, tachycardic, and develops frothy sputum. What is the priority? A. Administer furosemide 4. B. Check urine output. C. Elevate the head of bed. D. Apply compression stockings. Correct answer, C. Elevate the head of bed. Rationale: immediate airway improvement is required before medications. Strategy: airway/breathing interventions always come first. Question 4. A client with DKA has K+ of 2.9 milliequivalent/L. The nurse should: A. Administer insulin infusion. B. Prepare for potassium replacement. C. Restrict oral fluids. D. Give sodium bicarbonate. Correct answer, B. Prepare for potassium replacement. Rationale: insulin will worsen hypokalemia, potassium must be corrected first. Strategy: treat severe electrolyte imbalances before continuing therapy. Question 5. A post-thyroidectomy client reports sudden hoarseness and difficulty speaking. The nurse should: A. Offer ice chips. B. Assess for tracheal compression. C. Encourage coughing. D. Increase 4 fluids. Correct answer, B. Assess for tracheal compression. Rationale: hoarseness can indicate hematoma formation leading to airway obstruction. Strategy: post-neck surgery equals airway assessment first. Question 6. A client with pneumonia has a respiratory rate of 32 per minute and O2 sat of 88%. What is the priority? A. Obtain sputum culture. B. Increase oxygen delivery. C. Encourage fluid intake. D. Administer antibiotics. Correct answer, B. Increase oxygen delivery. Rationale: treat hypoxia before addressing infection. Strategy: airway and oxygenation always take priority. Question 7. A client with cirrhosis develops ascites and a distended abdomen. What is the most appropriate nursing action? A. Give acetaminophen. B. Assess for respiratory compromise. C. Provide high-protein diet. D. Offer carbonated beverages. Correct answer, B. Assess for respiratory compromise. Rationale: ascites increases abdominal pressure and can affect breathing. Strategy: evaluate for impaired breathing with any abdominal distension. Question 8. A client receiving heparin has a PTT of 110 seconds. The nurse should: A. Continue the infusion. B. Reduce the infusion rate. C. Stop infusion and give protamine sulfate. D. Increase rate slightly. Correct answer, C. Stop infusion and give protamine sulfate. Rationale: PTT greater than 100 indicates high bleeding risk. Strategy: identify signs of toxicity and administer antidotes. Question 9. A diabetic client receiving TPN has polyuria and thirst. The nurse should first: A. Check blood glucose. B. Increase infusion rate. C. Administer insulin dose. D. Switch to D10W. Correct answer, A. Check blood glucose. Rationale: TPN can cause hyperglycemia and requires monitoring. Strategy: assess before intervening. Question 10. A postoperative client reports calf pain and warmth. What is priority? A. Massage the calf. B. Place in high Fowlers. C. Notify the provider. D. Increase fluids. Correct answer: C. Notify the provider. Rationale: these are DVT signs, risk for embolization. Strategy: suspected embolic complications require immediate reporting. Question 11. A client with myasthenia gravis shows ptosis and difficulty swallowing. What should the nurse do? A. Withhold anticholinesterase medications. B. Administer pyridostigmine. C. Place client NPO for 12 hours. D. Increase 4 fluids. Correct answer: B. Administer pyridostigmine. Rationale: weakness suggests myasthenic crisis needing medication. Strategy: treat symptoms promptly to prevent aspiration. Question 12. A client with ulcerative colitis reports 10 watery stools per day. Priority is: A. Administer antidiarrheals. B. Monitor electrolytes. C. Provide high-fiber foods. D. Encourage ambulation. Correct answer: B. Monitor electrolytes. Rationale: diarrhea causes fluid/electrolyte imbalance. Strategy: identify dehydration risks early. Question 13. A burn victim with 30% TBSA presents with hoarseness. What is priority? A. Start fluid resuscitation. B. Prepare for intubation. C. Apply topical ointment. D. Insert urinary catheter. Correct answer: B. Prepare for intubation. Rationale: hoarseness suggests inhalation injury, airway may close suddenly. Strategy: burns above the waist demand airway assessment. Question 14. A client taking digoxin has nausea and blurred vision. What is the first action? A. Administer dose early. B. Hold medication and check potassium. C. Give antiemetic. D. Increase fluids. Correct answer: B. Hold medication and check potassium. Rationale: symptoms of digoxin toxicity, low K+ worsens toxicity. Strategy: stop suspected toxic medications immediately. Question 15. A client with chest pain unrelieved by nitroglycerin needs which priority test? A. CT scan. B. 12-lead ECG. C. Ultrasound. D. Stress test. Correct answer: B. 12-lead ECG. Rationale: rapid identification of MI saves myocardium. Strategy: chest pain ECG within 10 minutes. Question 16. A client with SIAD has serum sodium of 120 milliequivalent/L. What is the priority action? A. Give 0.9% normal saline. B. Restrict fluids. C. Provide salt tablets. D. Encourage oral hydration. Correct answer: B. Restrict fluids. Rationale: SIAD involves water retention and dilutional hyponatremia. Restricting fluids is essential. Strategy: identify whether the sodium problem is due to fluid excess or loss. Question 17. A client with suspected stroke arrives with slurred speech. What should the nurse do first? A. Give aspirin. B. Obtain blood glucose. C. Start 4 fluids. D. Prepare for carotid ultrasound. Correct answer: B. Obtain blood glucose. Rationale: hypoglycemia can mimic stroke, must rule out first. Strategy: always check glucose in altered mental status. Question 18. A client with renal failure has elevated magnesium. Which assessment is most concerning? A. Fatigue. B. Hypotension. C. Hyperactive reflexes. D. Severe bradycardia. Correct answer: D. Severe bradycardia. Rationale: high magnesium suppresses cardiac function, life-threatening. Strategy: prioritize symptoms affecting airway, breathing, circulation. Question 19. A client with a chest tube reports increased bubbling in the water seal chamber. What should the nurse do? A. Clamp the tube. B. Check for an air leak. C. Increase suction. D. Remove the tube. Correct answer, B. Check for an air leak. Rationale: continuous bubbling indicates air leak. Strategy: always assess equipment before calling the provider. Question 20. A client with Addison's disease is extremely weak and hypotensive. Which order is priority? A. Sodium restriction. B. Administer 4-hydrocortisone. C. Give oral potassium. D. Encourage activity. Correct answer, B. Administer 4-hydrocortisone. Rationale: Addisonian crisis requires rapid steroid replacement. Strategy: treat shock-like conditions immediately. Question 21. A postoperative client has 250 milliliters drainage in the first hour from a JP drain. What should the nurse do? A. Document the finding. B. Notify the surgeon. C. Empty the drain. D. Increase 4 fluids. Correct answer, B. Notify the surgeon. Rationale: excessive drainage may indicate hemorrhage. Strategy: know expected drainage amounts for each device. Question 22. A client on chemotherapy reports mouth sores. What is the priority nursing action? A. Offer spicy foods. B. Provide soft, bland diet. C. Encourage alcohol-based mouthwash. D. Increase carbohydrate intake. Correct answer, B. Provide soft, bland diet. Rationale: minimizes irritation from mucositis. Strategy: protect damaged tissues from worsening injury. Question 23. A client with liver cirrhosis has hysterexis and confusion. What is the priority? A. Reduce protein intake. B. Administer lactulose. C. Give potassium supplements. D. Obtain a CT scan. Correct answer, B. Administer lactulose. Rationale: lactulose reduces ammonia levels causing encephalopathy. Strategy: treat the underlying cause of altered mental status. Question 24. A client recovering from MI complains of chest pain during ambulation. What should the nurse do? A. Continue walking slowly. B. Administer nitroglycerin. C. Encourage deep breathing. D. Report pain as expected. Correct answer, B. Administer nitroglycerin. Rationale: pain suggests myocardial oxygen imbalance. Strategy: treat ischemic pain quickly to prevent reinfarction. Question 25. A client with anemia has shortness of breath and pallor. What is the priority? A. Increase iron-rich foods. B. Apply oxygen. C. Encourage rest. D. Offer warm fluids. Correct answer, B. Apply oxygen. Rationale: low hemoglobin decreases oxygen carrying capacity. Strategy: airway and oxygenation first. Question 26. A client with pulmonary embolism is anxious and tachypneic. Priority intervention? A. Place in high Fowlers. B. Encourage coughing. C. Offer bronchodilator. D. Give warm blankets. Correct answer, A. Place in high Fowlers. Rationale: improves ventilation and oxygenation. Strategy: positioning can rapidly improve respiratory distress. Question 27. A client on TPN suddenly develops sweating, shaking, and confusion. What should the nurse do first? A. Check the infusion site. B. Assess blood glucose. C. Increase TPN rate. D. Notify the physician. Correct answer, B. Assess blood glucose. Rationale: symptoms of hypoglycemia. Strategy: evaluate before intervening. Question 28. A diabetic client with foot ulcers asks why the wound isn't healing. Best response? A. You need more calcium. B. Blood flow is reduced in diabetes. C. Ulcers always take months. D. You need more antibiotics. Correct answer, B. Blood flow is reduced in diabetes. Rationale: poor perfusion delays healing. Strategy: use pathophysiology to guide explanations. Question 29. A client with hypovolemic shock has BP 8250. Priority intervention? A. Give oral fluids. B. Administer 4 normal saline bolus. C. Place in high Fowlers. D. Apply warm blankets. Correct answer: B. Administer 4 normal saline bolus. Rationale: restores circulating volume. Strategy: treat the cause of shock first. Question 30. A client with acute kidney injury has urine output of 150 milliliters in 24 hours. What is the priority? A. Document the finding. B. Monitor potassium levels. C. Encourage oral fluids. D. Offer diuretics. Correct answer: B. Monitor potassium levels. Rationale: oliguria increases risk of hyperkalemia. Strategy: identify life-threatening electrolyte imbalances. Question 31. A client with pneumonia begins to have restlessness and agitation. What is the nurse's priority? A. Reassure the client. B. Check oxygen saturation. C. Provide warm blankets. D. Increase fluids. Correct answer: B. Check oxygen saturation. Rationale: restlessness is an early sign of hypoxia. Strategy: ABCs always first. Question 32. A client receiving blood transfusion develops fever and chills. What is first? A. Slow the transfusion. B. Stop the transfusion. C. Give diphenhydramine. D. Obtain vital signs. Correct answer: B. Stop the transfusion. Rationale: prevent further reaction. Strategy: stop, then assess. Question 33. A client with stroke has right-sided weakness. Priority intervention? A. Place objects on left side. B. Increase fluid intake. C. Place objects on affected side. D. Allow client to eat quickly. Correct answer: A. Place objects on left side. Rationale: prevents injury and frustration. Strategy: position for safety and independence. Question 34. A client with rheumatoid arthritis reports morning stiffness. Best intervention? A. Apply cold packs. B. Apply warm shower. C. Increase activity immediately. D. Provide caffeine. Correct answer: B. Apply warm shower. Rationale: heat reduces stiffness. Strategy: no non-pharmacologic techniques. Question 35. A client with COPD has thick secretions. What is the most important action? A. Restrict fluids. B. Increase fluids. C. Give antidiarrheals. D. Decrease oxygen. Correct answer: B. Increase fluids. Rationale: hydration thins mucus. Strategy: support airway clearance. Question 36. A hypertensive client is prescribed hydrochlorothiazide. Which finding is most concerning? A. Dry mouth. B. Leg cramps. C. Mild fatigue. D. Increased urination. Correct answer: B. Leg cramps. Rationale: suggests hypokalemia. Strategy: always look for electrolyte warning signs. Question 37. A client scheduled for CT with contrast has a history of shellfish allergy. Priority action? A. Continue the procedure. B. Notify the provider immediately. C. Give high-protein meal. D. Apply oxygen. Correct answer: B. Notify the provider immediately. Rationale: risk of anaphylaxis with iodine contrast. Strategy: identify contraindications before procedures. Question 38. A client with heart failure has 3+ pitting edema. What is priority? A. Increase sodium intake. B. Assess lung sounds. C. Encourage ambulation. D. Apply dry heat. Correct answer: B. Assess lung sounds. Rationale: fluid overload can progress to pulmonary edema. Strategy, assess for worsening heart failure. Question 39. A client uses 3 pillows to sleep at night due to breathing difficulty. This symptom is A. Clubbing, B. Orthopnea, C. Cheyne-Stokes, D. Stridor. Correct answer, B. Orthopnea. Rationale, classic sign of left-sided heart failure. Strategy, no key terminology. Question 40. A client with septic shock has cold, clammy skin. What should the nurse do first? A. Give oral antibiotics. B. Administer 4 fluids. C. Apply ice packs. D. Encourage rest. Correct answer, B. Administer 4 fluids. Rationale, restores perfusion during shock. Strategy, treat low perfusion aggressively. Question 41. A client with asthma has wheezing and decreased air entry. Priority? A. Encourage deep breathing. B. Administer albuterol. C. Provide warm fluids. D. Teach pursed lip breathing. Correct answer, B. Administer albuterol. Rationale, rapid bronchodilation is needed. Strategy, rescue medications first. Question 42. A client with elevated ICP should avoid which activity? A. Stool softeners. B. Coughing. C. Maintaining head midline. D. Elevating HOB. Correct answer, B. Coughing. Rationale, increases ICP. Strategy, no activities that worsen pressure. Question 43. A client with acute kidney injury has severe hypertension. What is priority? A. Restrict foods. B. Assess for fluid overload. C. Encourage ambulation. D. Give potassium. Correct answer, B. Assess for fluid overload. Rationale, hypertension may indicate excess fluid volume. Strategy, identify cause of abnormal vitals. Question 44. A client with pneumonia on antibiotics develops diarrhea. What should the nurse suspect? A. Flu. B. C. Difficile. C. Viral gastroenteritis. D. Lactose intolerance. Correct answer, B. C. Difficile. Rationale, antibiotics disrupt gut flora. Strategy, associate symptoms with medication effects. Question 45. A client with DVT is receiving heparin. Which lab requires immediate action? A. Platelets 60,000. B. 1 Indian rupee. C. PTT 58 seconds. D. WBC 11,000. Correct answer, A. Platelets 60,000. Rationale, risk of HIT, heparin-induced thrombocytopenia. Strategy, no dangerous lab values. Question 46. A client with hyperthyroidism has tachycardia and weight loss. Priority is A. Provide high-calorie meals. B. Administer beta blockers. C. Increase fluids. D. Encourage exercise. Correct answer, B. Administer beta blockers. Rationale, controls life-threatening cardiac symptoms. Strategy, treat cardiovascular complications first. Question 47. A client with dehydration shows tenting of skin. What is the priority? A. Encourage oral fluids. B. Provide sports drinks. C. Start 4 normal saline. D. Offer fruit juices. Correct answer, C. Start 4 normal saline. Rationale, severe dehydration requires rapid 4 fluids. Strategy, 4 before PO when symptoms are severe. Question 48. A client with meningitis has nuchal rigidity. What is priority? A. Initiate droplet precautions. B. Encourage mobility. C. Provide warm compress. D. Give high-protein meals. Correct answer, A. Initiate droplet precautions. Rationale, prevents transmission. Strategy, safety for patient and staff. Question 49. A client with MI is prescribed morphine. Why is this drug beneficial? A. Increases heart workload. B. Reduces preload and anxiety. C. Raises blood pressure. D. Increases respiratory drive. Correct answer, B. Reduces preload and anxiety. Rationale, improves oxygen demand. Strategy, no dual effects of key medications. Question 50. A client with acute asthma is not responding to albuterol. Next priority? A. Administer 4 magnesium sulfate. B. Encourage coughing. C. Offer warm fluids. D. Apply cold compress. Correct answer, A. Administer 4 magnesium sulfate. Rationale, magnesium is a bronchodilator used when first-line therapy fails. Strategy, no escalation steps for emergency conditions. If you made it to the end of this video, you've just invested in your future as a nurse, and that already puts you ahead of thousands of other candidates. These 50 medical surgical NCLEX questions were designed to challenge your judgment, sharpen your critical thinking, and prepare you for the toughest scenarios you'll ever face on the exam. Now I want to hear from you. Comment your score below, tell me which question pushed you the hardest, and let me know the next topic you want me to cover. Don't forget to like this video, share it with another nursing student, and subscribe so you don't miss any of the advanced NCLEX trainings coming up. Your license is closer than you think, keep going, keep practicing, and I'll see you in the next NCLEX masterclass.